updated on a regular basis like flu vaccine is to try to keep up with the evolution of the virus?
Over the past 4 months, several countries have reported incidents of contaminated cough syrups for children. Last year, WHO raised the alarm by issuing medical alerts in October, focused on the Gambia in November, about Indonesia, and earlier this month regarding Uzbekistan. The cases in these 3 countries are associated with more than 300 deaths, but we know that at least 7 countries have been affected. Most of the deaths have been in children under the age of 5.
Issue of whether or not COVID vaccines should be made an annual vaccine.
These contaminants are toxic chemicals used as industrial solvents and antifreeze agents that can be fatal even in small amounts and should never be found in medicines. This week, WHO released an urgent call for countries, manufacturers, and suppliers to do more to prevent, detect, and respond quickly to contaminated medicines.
I think this would go to Dr. O'Brien if she's on the line.
So the concern that we have, and the reason why we are bringing this back again, even though the medical product alerts went out, is these medications are common medications. Some of them are cough syrup, they have antipyretics in it, they have acetaminophen in it, and the chemical that's added to the product is what's causing the death, the unnecessary death of these children. And that's why it is very important for significant vigilance that takes place, and also for the unidentified cases of death. We notified this, and we noticed this, and we were able to pick it up because it happened in a group, in a cluster. It was an unusual scenario. But there might be children out there exposed to these medications that we're not even aware of.
Yesterday, the Food and Drug Administration in the United States.
We deplore the abduction of WHO colleague, Dr. Mahamadou Diawara, who was taken by unidentified assailants from his car on 23rd January in the town of Menaka in northern Mali. We're working with local authorities to investigate the abduction and ensure our colleague's quick return to his family. Health workers should never be a target.
And whether, in fact, older people.
Since the beginning of December, the number of weekly reported deaths from COVID-19 has been increasing. In total, in the past 8 weeks, more than 170,000 people have died of COVID-19. That's just reported deaths. The actual number of deaths is much higher.
Does WHO feel we're yet at a point where we know whether?
This week, the Emergency Committee on COVID-19 will meet to discuss whether the current situation still constitutes a global emergency. While I will not preempt the advice of the Emergency Committee, I remain very concerned by the situation in many countries and the rising number of deaths.
Advisory group, VRPAC, later this week to give it some advice on the issue.
Do not underestimate this virus. It has and will continue to surprise us, and it will continue to kill, unless we do more to get health tools to people that need them and to comprehensively tackle misinformation.
No, that's very fine indeed, and we also had the opening remarks by the Director.